Our next witness is Michelle Cotterman, who is going to address that issue.
Good afternoon. I think it's afternoon now. It might still be morning. I didn't look at the clock, but good afternoon or good morning.
1 minute to go.
Madam Chair Lehner, Vice Chair Brenner, Ranking Member Fedor, and members of the Senate Education Committee, thank you for this opportunity today to express my opposition to Senate Bill 121. My name is Michelle Cotterman. I am a registered nurse, but most importantly, I am a mother of 2 beautiful and healthy school-aged children. We take health and wellness very seriously in my family, and it is a topic of discussion almost every day of the week. I have been closely following the discussion surrounding this bill. I am opposed to Senate Bill 121 for multiple reasons, but I will address here my top objections and most burning questions. During proponent testimony, it became very clear that there is nothing currently stopping local school districts from establishing health standards in writing health curriculum, except for the lack of support and professional development needed to write such standards and curriculum. An argument was proposed that we need statewide adoption of health standards that can apply across the board, yet it was also stated that districts do not have to adopt the standards. It is simply another option. How does the adoption of an optional health standard address the support and professional development issues currently affecting local districts? During proponent testimony, there was a lot of talk about prediabetes, diabetes, and obesity, particularly amongst persons of low socioeconomic status. Senator Brenner asked an excellent question regarding what has changed between now and 30 years ago when we didn't have health standards and we didn't have the issues of diabetes and obesity, and the simple answer was diet. I completely agree with the need for comprehensive nutritional education that is necessary to prevent chronic disease, but nutrition is already a component of required curriculum, and as previously stated, not fully utilized due to lack of support. Since Ohio is the only state in the nation without these health standards, are we the only state in the nation dealing with epidemics of diabetes and obesity? Has there been any evidence submitted that proves adopting these optional standards will statistically lower the burden of diabetes and obesity? And I keep hearing everybody weigh in on this report that was provided by the Health Value Dashboard, that we're 46 out of the 50 states. But I just want to draw your attention to the fact that there's a lot to be desired here. If we are the only state that is lacking health standards, why are all of these other states also ranking poorly in their health status outcomes? I assure you it is not for lack of health standards. One of the things that they pointed out in this report is that Ohioans experience poor health outcomes, and all of the reasons they state is because of lower socioeconomic status, lower income, and to me, this translates directly to an access of quality food sources. According to the bill analysis, current law requires the passage of a concurrent resolution by both houses of the General Assembly before the state board may add or revise any standards or curriculum for health education. Prior to voting on the adoption of the concurrent resolution, the standing committee of each house must hold at least one public hearing. The bill removes that requirement. It appears that is the true intention behind this legislation, to remove the legislative process and therefore public involvement, which is designed as a check and balance to prevent special interest groups from adding health curriculum that may not be in the best interest of Ohio citizens. What is the true purpose of this legislation? In summary, Ohio Revised Code 3313.60 designates required health curriculum, including nutritive value of foods, harmful effects of drugs of abuse, alcoholic beverages and tobacco, venereal disease education, personal safety and assault prevention, dating violence prevention, prescription opioid abuse prevention, physical education, first aid, including a training program in CPR. Teachers need support and professional development to fully teach the already required health curriculum and not a new law creating just another option. Children need access to high quality food, which includes the food they receive while at school. What they don't need is more boxed education, standardized tests, and desk time. I agree with the current Ohio required curriculum on health. I agree with the process for adding curriculum. And I ask that you oppose Senate Bill 121. Thank you for your consideration of these concerns, and I am happy to answer any questions you may have to the best of my ability.
Okay. Thank you very much. Any questions? Senator Sykes.
Thank you, Madam Chair, and thank you for your testimony. Just wanted to address one issue in particular you raised about not having public hearings and not having public input. We do have a State Board of Education that is made up of persons appointed by the governor, as well as most of them are elected through large districts, about 1 million people that they represent. And that state board, this public body, that public meetings that deliberate very carefully over these kinds of issues, and there will be public hearings and opportunity for the public to give input in that process, just like they do in all of the other content areas where we have standards. So it would not eliminate the opportunity for the public to have some input, and it would not put more emphasis on opportunity for special interests to have more influence. I just want to make sure that was clear.
Thank you, Madam Chair. Thank you for that, Senator Sykes.
One observation that I had, you listed a number of things that should be taught in health education. We have to make sure that we clarify the difference between topics, and what you gave us were a list of topics, and standards, which are more refined than merely a topic. What about that topic needs to be taught? So that's where standards come in, and then you have curriculum after that, which is the how, the why. That's what we have traditionally regarded as being the province of the local district, on all topics, not just health, but English, math, anything else. So what we're really looking at here are just a more robust list of what needs to be taught. What needs to be taught. The how is up to the local. But we're certainly, I think, open, at least I'm open, and I know other members of this committee are open to excluding from the state province at all those areas that I think touch on deeply held personal and religious beliefs. So it's just a question, can we do that? Can we get there? I'd like to think we could, that you'd be satisfied in the end and other people would be satisfied in the end. But it's a challenge, and I think we just have to see if we can't get there somehow. Okay.
Thank you, Madam Chair. I appreciate that. May I just
Sure.
add something to that? I do appreciate, both you and Senator Sykes and your input on that. I think, one of the concerns that I have too here is that it's not a lack of a standard. And I don't think that there is anything that currently prevents a local level from developing their own curriculum and utilizing this particular standard when developing the currently required curriculum under Ohio Revised Code in order to develop whether or not a child is meeting those particular criteria. But when I hear testimony like what was received from, I think it was Dr. Lorson, that there's a lack of professional development and support in developing that curriculum, how would passing these standards provide that lack of support and professional development in order to write a curriculum on a local level?
We'll have to ask Dr. Larson. He's back there. If you want to ask him afterwards, I'm sure he'd be happy to help
I would.
you.
Thank you.
Okay. Anything further?
No, thank you so much.
Thank you very much. Our next witness